Hi, welcome. I'm Dr. Keith Javery, and I'd like to talk about the Javery Pain Institute's continuing video series on all things pain. Today we're going to talk about cancer pain, the dreaded C word. And unfortunately, many studies show that the thing that all of us seem to fear most about getting that horrific diagnosis is the pain that may or may not be associated with it. In fact, studies do show that most patients fear it's not the survivability as much or the treatments, but the actual pain. Is this going to cause me a lot of pain? Now, there's all sorts of cancer. Cancer is a very wide array of problems to where, for reasons sometimes that we don't know and sometimes that we have strong suspicion of, where cells start to divide and produce other cancer cells at a much faster rate than any other normal cell. Those cancer cells grow and they take up resources and they take up energy and they eventually take over and spread everywhere, and unfortunately without treatment that can be the end. But the good news is that with today's technologies and treatments offered by our cancer specialists and by other supportive specialists, that not only is cancer frequently beatable, it usually is, but there is one caveat. If one does face the challenge of fighting cancer, the cancer itself sometimes does produce pain, and sometimes the pain can be bad without treatment. But sometimes pain of or from cancer is as much from the cancer, and sometimes it's not from the cancer itself. In fact, frequently, a vast majority of patients' cancer is actually from the treatment of the cancer. For example, a lot of patients with certain types of cancers will have to have surgery to either remove the cancer or the areas around the cancer to prevent its further spread. And we all know that surgery can cause scar tissues, it can cause injuries to nerves, adjacent viscera or organs or that type of thing. And then those changes, the scarring, the nerve inflammation, can cause pain all and from itself. And yet subsequent studies or scans show, guess what? You're pain-free, you're cancer-free, but yet why does my pain still hurt? In fact, why do I hurt worse? Is the cancer back? When it's not back, unfortunately, the treatments itself sometimes can cause pain. But even when, unfortunately, if surgery hasn't been done or if the cancer is still there, the treatments, for instance, radiation. Radiation is a very high, powerful ionizing radiation where it vaporizes cancer cells or kills cells, but radiation can't tell the difference between a good cell and a bad cell. And so nerves, for instance, get in the way of cancer cells, and they can get radiated, and you can get radiation damage. And nerves that are radiated, for instance, get damaged and can cause severe nerve pain. Nerve pain can feel anything from cramping to burning to stinging to tearing, pulling. It's described by a lot of different ways by different patients, but it's very difficult to treat. But it's not directly due to the cancer. It was due to the treatment necessary to treat the cancer. In addition to that, a lot of joints or muscles can be weakened or destroyed from the cancer, and even though the cancer was killed or surgically removed, it left with it a lot of marginalized or a lot of atrophy in muscles, joints, tendons, or even bones. Cancer that invades bones can break bones or weaken bones, fracture them. So you see, the point is that cancer-related pain sometimes is about the cancer, but it frequently is not just about the cancer. There's a lot of different people that treat cancer, a lot of fine organizations. One of them everyone's familiar with, hospice. It's a wonderful organization formed many years ago when patients would get the diagnosis of cancer, and if they were facing a situation where even with treatment, and sometimes without treatment, if they had pain and suffering, they would be managed by cancer specialists, hospice pain specialists, now known as palliative care specialists, where the effects of pain and the side effects of the treatments, whether it be nausea, vomiting, dizziness, pain, nerve pain, aching pain, throbbing pain, are dealt with a variety of different medications and other support therapies. The problem with some of that is that some of these medicines, if not many of them, produce significant side effects. For instance, sleepiness. And then to combat the sleepiness, sometimes medicines are given to wake a patient up. But then that makes a patient more nervous and anxious. And we all know that I would hardly be calm if fighting cancer, and I'm afraid most people wouldn't either. So the challenge is to try to treat the cancer or the treatment-related pain from the cancer treatment without producing a lot of the side effects that we typically see with painkillers, whether it be the narcotics or the anti-nerve pain medicines or different type of medicines targeting different type of pain patterns. The advantage of interdisciplinary interventional pain, our specialty here at Javery Pain Institute, is that if we can, and we typically do, we try to identify where the pain is emanating from. Is it emanating from the cancer, or if the cancer has been solved or the cancer has been cured, what structure has been damaged, irritated, inflamed, or changed or altered that is currently still producing the patient's pain. And we do this with various interventions. Diagnostic injections, specific types of nerve, joint, spinal, non-spinal injections which identify without a doubt where the pain is coming from, and then when proper medicines are injected, pain is relieved, sometimes for days, weeks, and months at a time. And if it's the unfortunate situation where I have my patient that indeed the cancer has spread and there may be little or limited time left, a lot of my patients tell me, Dr. Javery, one thing I want is I want to spend what time I have left with my mind and my spirit alive and present so that I can spend the time that I have left with me being fully aware, as awake and as cognizant and as sober as possible so that I can spend that time with my family, my friends, my loved ones as present and as sober and as awake as I can be, but I still want to be and need to be comfortable to do so. And that is one of our main focuses at Javery Pain Institute, to find out exactly where that pain, whether it's the cancer and or the damage that sometimes cancer treatments provide, and target that and treat the pain at its source rather than only just covering it up. We do use medicines to help with that, but when we apply these targeted specific techniques, we found, and our patients have found, that they don't need as much or sometimes at all of the drowsy or the sedating medications that other patients need without these techniques. So I know I've had many patients that have sent me some touching letters, and sometimes after they do pass, and their family tell me, thank you. I was able to spend much more quality time even up until the end. Or in patients where the patient isn't terminal, they tell me, I thought I'd have to live with this forever, and you've been able to help me with this, and I'm finally able to think clearly. I'm not falling asleep at the table or at dinner or whatever, and they're able to live life sharper and fully present. So with that, I just wanted to spread that message and give you that information that sometimes isn't out there or so available. And if you have any questions, check out our website, www.javerypain.com, and give us a call or write us an email. Hope to see you soon.